Hello viewers, welcome to my channel. Today I am going to talk about local anesthesia. In ENT practice, we do many surgeries under local anesthesia. We prefer it because of its safety profile, and there are some advantages of local anesthesia over general anesthesia. Number one, I mentioned that its safety profile. It is less expensive than general anesthesia. It causes less bleeding, and perioperative patient's response can be recorded. But is it totally safe? No, actually not. Side effects may occur from local anesthesia. There may be dizziness, there may be agitation and lightheadedness. In severe case, there may be convulsion, cardiac arrhythmia and asystole. So to avoid this complication, we have to limit the dose of local anesthesia within the acceptable range. So how to calculate which amount of local anesthesia to infiltrate in a patient who is having a weight of 70 kg? Let's check.
First, plain lidocaine. The highest dose is, in some books it is 3 mg per kg body weight, and in some books it is 4.5 mg per kg body weight. If we take it 4 mg per kg body weight, then in a 70 kg weight patient, the highest dose will be 4 into 70 equal to 280 mg. The highest Lignocaine can be given. So in 1% lidocaine, 10 mg is present in 1 ml, and 280 mg is present in 280 divided by 10, that is 28 ml. So in 1% lidocaine, we can give highest 28 ml to a patient of 70 kg. And if it is 2% lidocaine, then 20 mg is contained within 1 ml. So 280 mg is in 280 divided by 20, that is 14 ml. Here, highest 14 ml can be injected. And lidocaine, when mixed with adrenaline, the highest permissible dose is 7 mg per kg body weight. So in a 70 kg patient, the highest 7 into 70, that is 490 mg can be given. Then the calculation is similar. When it is 1% lidocaine, then divide the required amount by 10, and when it is 2% lidocaine, divide the required dose by 20 to get the maximum milliliter of lidocaine solution that can be injected to the individual.
So in case of complications, what to do? First, discontinue the local anesthesia. Then administer 100% oxygen. Patient needs to be intubated. Barbiturate should be administered for convulsion. For asystole, atropine is administered. Cardiac resuscitation measures needs to be taken. And the specific antidote is 20% intralipid. So what to do when we need large area of infiltration? We can dilute it with normal saline. When mixed with epinephrine, the duration of action of lidocaine is 4 hours. It is almost enough for many ENT surgeries. Thank you for watching. Goodbye.